Well, good afternoon, everyone. Thanks so much for having me here to talk, and thanks so much to the library for having me here. I'm going to talk to you today a little bit about a health topic and some things that can be done. And so I'm going to be basically talking to you about how low-level laser can be used to help with certain health problems and with certain pain problems. And so to get ready, I was on ChatGPT, of which I'm not that great, and so I asked it to draw me a picture of a lady cutting a pie with a laser. And so that's the picture that I got.
It looks more like a lightsaber to me.
It kind of does look like a lightsaber, so I like that. But then I kind of put my deal on there for the talk today. It takes time and repetition to change the body. But anyhow, I was on ChatGPT. The young lady that was handing stuff out for me today, that's my wife, Stephanie. And she doesn't like me to tell people when it's her birthday, so I won't tell you that it's her birthday on Tuesday.
You just did.
Yeah. Oh, I did, didn't I? So anyhow, I asked the ChatGPT to make a picture of my wife, so I described her. And if some of you know her, she really, really likes animals, and she really, really, really likes raccoons. So I asked ChatGPT to draw a picture of her, and this is what they gave me. So, looks a little bit like her. Her hair is more colorful than that. So what I'm trying to say here is it takes time and repetition to change the body. So even if it's sitting on the couch eating every day, it takes a lot of time and a lot of repetition of doing the same thing or not doing the same thing to change the body. And the other way around is when you want to change it in a different direction, it takes time and it takes repetition to change that body. I got a picture here of Jack LaLanne. I'm sure most of us are familiar with Jack LaLanne, but he's 70 years old and he's pulling 70 boats on his 70th birthday. I don't think I could even swim it alone, let alone pull boats full of people. And Jack made it to 96 years old. And he was in pretty good shape right up to the end. And the key to life and the key to aging is that to the extent we can, we have to keep moving. Probably the worst thing to do to anyone is have them sit down and stay in place. So this deal here is, why am I a chiropractor and why am I excited about the laser? So I'll tell you a little bit about myself and how I ended up getting here. Because it'll kind of play into why I'm so interested in the laser and what it can do to help people. So I grew up as a farm kid in Minnesota, and I remember my folks having people over for coffee or being together in groups, and usually someone would end up talking about a health problem or this or that or the other thing, and sometimes they'd talk about the chiropractor helped them. So-and-so had a bad back and couldn't work, and the chiropractor helped them. And I thought that was pretty cool, so I got interested in being a chiropractor, and I thought that would be an interesting way to go. I did, however, wait till I was 38, till I finally got my act together and went back to school. There's someone in the crowd that knew me when I was 19, Judy, and she can probably explain to you later about some of that stuff when I was younger. But when I was 38, I finally matured and went back to school. But when before I turned 38, I worked at the hospital in town here in surgery. And so one of the things we started using in surgery was lasers. And so we would use lasers to stop bleeding. And so you could use that on the body. And then sometimes people have a blood vessel break in their eye, and they use a laser, they stick a little tube in there and put a laser in the eye to stop the blood vessel from bleeding. Well, we couldn't use the same laser for both, because depending on what use you need would depend on which laser we would use. And so we had 3 or 4 different types of laser depending on what the doctor needed to use. But usually we used it to heat up tissue and to change a tissue or to obliterate it, which means it would just go away. And so when I went to chiropractic school, I was walking down the hallway one day and there was a big sign up and it said, come listen to Dr. Michaelis talk about chiropractic and laser. And of course I was thinking of the laser beams I saw in surgery. And my first thought was, well, what the heck are chiropractors doing with lasers? Well, when I went there, he started talking about a low-level laser. It doesn't produce any heat, but it affects the body in a different way. And so now the big question is, if you're sitting there, and if you're sitting there like I was, the question is, well, can light affect the body?
Yes.
You are correct. And so here's an example that we all know. On the left, we have a plant that's grown in normal light, and to your right, there's that stringy plant. Well, that's not getting much sunlight, so it gets stringy. So those plants are highly affected by light. Yes?
Another example would be like UV light affecting the skin.
Oh.
Or like UV radiation or whatever.
Absolutely, yeah. And so what he was just talking about, I got a little picture here. So when a mother gets a newborn and the newborn has kind of got a yellow tone to their skin, what does the mom usually do with the baby? Sticks them in the sunlight, right? Because that sunlight affects the body. And so if you get a newborn mammal and you keep their eyes covered and they don't get any light, their eyes aren't going to develop. What happens when you walk outside on a warm, sunny day? You can kind of feel the sunlight, but you actually kind of feel it a little better, don't you? I'll walk outside and it's sunny and I just smile. I just feel better. Sunshine, when it hits you, it allows your body to produce vitamin D, which is terribly important for your body and your health. But on the other side is what happens when you stay out in the sun too long. And this is our UV quote. So you get the poor little guy there at the tan lines, and I'm sure we've all been burnt and had some peeled skin. So definitely light can affect the body. Well, what makes laser different? So the laser light, if you remember from school, if you ever had the prism and you'd shoot light through it, it would give off that rainbow color. And so all those rainbow colors, all those lights are different. And so you got the red, orange, yellow, green, blue, indigo, and violet. And so they found that the red and the violet and the green lasers have a really strong effect on the human body, on our individual cells. I pretty much work with the red laser because that does the best job of helping to reduce pain and inflammation. And I won't have a big science course here, but in our individual cell, we have the nucleus. Most people know about that. That's the center of the cell. And then there's these little things floating around in there called the mitochondria. And I think they look a little bit like a kidney bean when you eat chili, right? And so the kidney bean, when you eat chili, has that red lining around it. Well, in the mitochondria, that has a cell wall. And what happens is when we take in nourishment, the sugars go to that cell wall. It goes through a series of layers, and that creates electricity for the body. That creates the energy that our body needs. The laser directly affects how that energy gets inside the cell. So on a cellular level, the laser's turning that cell back on and making it work correctly again. So this affects the cells directly. It helps the cells to release energy. That ends up reducing inflammation in the body, which ends up taking pressure off of nerves, reduces pain, and it allows the cells to be healthier. So over time, being lasered a series of times will help the cells to become healthier. Another good question I sat there and asked myself was, well, that's just a low-level laser light. How can that penetrate anything? How can that get down and help your knee or get to where you want it to get? And in fact, light does penetrate the body very well, as we know from going outside and being felt to warm up. And I brought the cheap little flashlight here. And so if you put this behind my ear, even in the daylight, you can see my ears red, right? So you can see that that light's getting, it's not shining through there. If you want it to shine through, I got to do that, right? So it's not shining through my ear, but it's getting in there and it's affecting all of that tissue. So when we work with a patient with low-level laser, it seems like it's just touching the skin, but the body absorbs it, it takes it into the cells, and it helps those cells to get healthier and for the body to work better. What can laser help to treat? Oh, you know what? Is there any chance you think we can get this plugged in? Oh, would you do that for me, Mark? Can you just...
The USB stick?
Yeah. I wonder if we could pull that up quickly. because I sent her, I went and added a couple slides after that. Can you pop that up for me while I talk?
Pop,
Can you just pull that up?
pull it up.
Oh, there we go. I could probably do it. Okay, we'll just do it that way.
We got it?
Yeah, what do I have to do to put it on up on the screen?
That's a question for the tech guy, if I remember right.
Oh, okay. Well, if not, I think we'll be okay. I'll just read them myself. Okay, sorry about that. I went and sent her the stuff, and then I got a really good idea, and I added a couple more.
You're back on the screen now.
Oh, it is?
It's just a blue screen?
Oh, well, blue is a good color. Well, oh, here we go. I see what I did. So what can laser help to treat? So a pretty good number of things. So I'll tell you maybe a couple of cases I worked with and how things went for the patient. So what happened is I've been working with laser since I think 2007. So I got about 18 years of working with it and working on people. A little over a year ago, I had some patients come in and they felt like it helped their neuropathy, so the pain and numbness and tingling in their legs, which I hadn't really been treating people for that, but I had a couple people come in and they got better. Well, they had started sending their friends in, and I thought, oh, I got something here. And so my laser was old, right? And my laser was like a really good screwdriver, but I needed a torque wrench, right? I needed something a little better. So I went and found another laser that I felt was a little more fitting for helping people who had neuropathy problems. And so I had one lady coming in, she was using my older laser, and she could tell the difference on the new one. And what she had was basically some nerve numbness on her one leg, and then her other knee, she had a lot of pain and inflammation. And she felt that that newer laser did a better job of treating it. So I treated her 12 to 15 minutes with the laser on each leg, and she noticed a difference. She called her friend up who had come in for the older laser, who felt like it didn't help her at all, and she came in for the new one, and she said, well, how many times do I have to come in? I said, I don't know, you know, it takes time and repetition, and we're all different. And she ended up coming in, if I remember, she came in about 4 or 5 times, and she said, you know what, this isn't really helping me, I'm not gonna come back. I said, I understand, but she still had her treatment that day. And then probably about 3 days later, she called me and made an appointment. She goes, I think it was a Friday, she said, can I get in on Monday? And I decided not to ask her any questions. I said, yeah, that'll be fine. So I set her up for an appointment. And she came in and she says, yeah, the day I called you, she said, I went shopping with my grandkids all day, got done at the end of the day, and I realized my knees didn't hurt anymore. So she was pretty happy with that. And so I've had people come in with ankle problems, foot tingling, knee pain. It's really nice. I have some people coming in where they're a little older and the doctor said that they just don't feel they need to do surgery to them, or their health isn't strong enough that they want to get a total knee replacement. But they're slowing down on the moving, so their knees hurt so bad they can only walk a half a block or a block. So then their goal is they're just going to be happy if they can walk 3-4 more blocks, because if their knees hurt less. So some of them can get results that stay for them, and some get results that they last a while, and then they start walking a bunch and it starts bothering again, and then they come back in if they need to come back in. Had people come in with arm problems. Anyone know what a trigger thumb or a trigger finger is? It goes down and it catches. And so I was pretty honest with the first lady, and I said, I don't know if this is going to help, but it would be neat to try. And sure enough, in a few treatments, her inflammation went down, and it still caught a little bit. And then she called me up about 3 weeks later and she said, you know, since my last treatment, this has continued to get better, and that thumb isn't catching at all anymore. So she avoided medication and surgery because of that. So it's really good for people who want conservative care. It's good for people who can't get care otherwise. The slides that I didn't put up for us, I had a picture of a nerve, and the nerve is a long tubing, and it's covered basically with fat for insulation. And as people get neuropathy and problems with their nerves, that starts to erode away, and it isn't as healthy as it should be. And so the laser helps that tissue to get healthier. And then the question is, well, how many treatments are you going to need? And that's going to be on an individual basis. So most people come in, and as they progressively get better, then they come in less often. And when they're to the point where they feel they're good, then they stop coming in unless they feel they need to return for something. So that's how that one works. But then people do with the laser, sometimes they do well with better nutrition, obviously. We've kind of been fed a story on no-fat diets, low-fat diets. Well, our brain is about 80 to 90% fat, because that's what's coating all those nerves and all the stuff in the head. So if someone calls you a fat head, it's actually a compliment. Someone calls you a fatless head, that would be an insult. So getting the good fish oils and that stuff in the body would help. If we're talking about neuropathy, some other things that can help is some people will do some foot baths, and some people will get these vibrating pads where they put their feet on them and it vibrates their feet. And some people just set their feet on there, and some people will stand up, and that'll actually help to strengthen the legs because it gives a lot of feedback from the bottom of the feet back up to the spine and up to the brain to really kind of wake the body back up and make that work correctly again. I think that's about it, which my speech teacher told me is not the way to end a talk. Don't say, and that's about it. Right, I just wanted to see one more thing. I thought I had a point of it, but oh, I know what I got to do. I'm back with the program. Yeah, this one just said, just like every cell in the body, the nerve cells need oxygen-rich blood, which this helps to survive. But as circulation and age slows down, so that vibrating pad helps to increase that circulation, and so do the warm foot baths. So certainly we've shown that we can repair this damage and people can get better. As usual, there's warning signals from your body. As we deteriorate, we start getting pain or numbness and tingling. So now that there's some questions, I have one way in the back.
Well, your brochure says arthritis. What does it do for arthritis?
Okay, what does the laser do for arthritis? So anything that ends in the itis, it is, or itis, itis means inflammation. So anytime the doctor tells you have itis of anything, it means it's inflamed. So if you have appendicitis, your appendix is inflamed, but usually that's because there's bacteria in there, and you got to get to the doctor and get that out. But a lot of what we deal with in our health and our lives is small amounts of inflammation, and that inflammation gets in there and it erodes that cartilage away. So the laser over time will slowly help the body to repair that. To what extent is hard to tell, but I have had patients come in with a lot of relief from arthritis pain. Yes?
Like how much on an average would your treatment cost every appointment?
Correct, okay. So the normal cost for the treatment is $50, and sadly insurance does not pay for that, and so the patient pays that on their own. Yes?
Does it help with like brain damage, like epilepsy or anything?
Does it help with brain damage and epilepsy? So the laser, I would work with you on neuropathy. I would not use that for someone with epilepsy and brain damage. But I have another laser, and that one is made more for neurology. And that one is, it's pretty amazing. I've seen some pretty good miracles with that, with people with brain injuries. I've worked with a lot of athletes that have had concussions. And what that laser does is it helps to turn the nerves back on, and then it helps the body to reduce inflammation, so it greatly reduces inflammation. So it usually turns like the concussion patients around pretty quickly. But then there's also a long series of steps that I do of neurological things, like having the person look up and to the left and down to the left and to the right and the left until we can get those patterns to work correctly, and then we go through a whole process to repair those things. Yep. No one wants to ask how old my wife is? Like which birthday this is? I know I will be damaged, yeah, if I give out that information. Yes? Yeah, the laser that I have has a computer on there, and it sets up the time. So I've gotten, this one's pretty easy. So there, a little figure of a person comes up, and I'll push on there if it's the neck, the shoulder, the knees, or whatever. And those vary from 8 to 15 minutes. And yep, so that's what I charge for that. Yeah. Yes?
Have you had any success with plantar fasciitis?
So about 85% of plantar fasciitis problems are actually coming from the calf. And we all think, oh no, it hurts on the bottom of the foot. But the calf tightens up, all that stress comes down to the Achilles tendon, and that transfers into the plantar area. And so usually with people with plantar fasciitis, it's probably a good idea to get their low back adjusted, but definitely adjust their knee and ankle. And then I do some muscle work on the calf muscle, and then to get that calf muscle lasered and then laser the bottom of the foot. Doing those two things together helps tremendously. Yep. Yes?
Gout and arthritis, are they treated the same?
Yeah, I mean, with the laser, I pretty much focus it on there. I don't know how to answer you about the gout. I mean, I would assume it would help, but I've never treated anyone with gout. Sometimes people come in with something, like you would come in and say, hey, I got gout, can you help me? I would probably look at you and say, I will find out if I can, and then I call the company, and they have a couple of doctors that work there, and I call the doctor and I ask them if they've had luck with it, because I don't want to pull someone down the wrong path either, or try to help you if I really can't. So I would actually call them and talk to them and see how effective it is. Any other questions?
Does Medicare cover this?
No. Nope, you're on your own with the laser. Insurance doesn't cover that. I've been told that some people have had some luck, and I just talked to a guy the other day, and he tried to tell me that the VA is covering some of it, and I don't know if that's true or not, because I haven't seen that happen.
It is.
It is covered with the VA?
Covering some of it.
Okay. There you have it. So I have the brochure there. That's your ticket if you want to ever call me and ask me questions, or if you want to come look at the laser, if you want to see how it works, I'd be happy to demonstrate or show that to you. Yep. Any other questions? Well, I sure appreciate you having me here today, and hope you enjoy your evening. Thank you.